Welcome back to Coast AM. I am Lisa Garr, and I have a question for you. Has your scheduled surgery that you had before COVID, has that been canceled? Or maybe you're afraid to go see your doctor that you had a regularly scheduled visit with because of the current COVID situation? Well, my guest today, Dr. David Hanson, quit his complex spinal surgery practice, and he has dedicated his life to stopping unnecessary and harmful surgeries and ending chronic pain without the surgery. He did this before COVID-19 happened, and because basically he relates everything to inflammation, and all chronic disease basically should be addressed before surgery. All inflammation should be. Well, it turns out then during this experience, Dr. Hanson got coronavirus, and he experienced it firsthand and really learned the intricacies of the immune system. And when it comes to the inflammatory response of the immune system, he is now part of a think tank that talks about how to calm these cytokine storms that can get out of control, which lead to a bad result of COVID. If you can keep them under control, then you can recover. So we're going to talk with Dr. Hanson after this quick break. I'm Lisa Garr. You're listening to Coast AM. Welcome back to Coast AM. My guest is Dr. David Hanson, and he had a very successful complex spinal surgery practice, and he has since quit because he realized that he needed to dedicate his entire life to stopping unnecessary and harmful surgeries that could be repetitive and ending chronic pain naturally through inflammation. And inflammation is the key to all chronic disease, including what we're experiencing with COVID-19. Welcome to the show, Dr. Hanson.
Thank you very much.
Absolutely. So you're an orthopedic spine surgeon.
Correct.
And you've helped people with chronic pain for a long time. I know back surgeries, once you go in that direction, they can be multiple back surgeries. What was your experience when you were doing the surgeries?
Well, I'm one of those surgeons who was on both sides of the fence for many years. So I spent about 8 years in practice doing very aggressive surgery. And I came out of my fellowship convinced it was the right thing to do. But the data came out in 1993 that a fusion for back pain had a success rate of 20%.
Ooh.
And I just stopped. And in the last 50 years, there has not been one research paper that documents that back surgery should be done for back pain. Not one.
Wow. 20% success rate, that is very low, no matter how good you are.
Right. So surgery went fine, and people still hurt. And the neuroscience the last 10 years has been very compelling. So we now know that chronic pain is memorized. It's like riding a bicycle. And when you do surgery on something that's memorized, it's similar to doing surgery on phantom limb pain, which the leg is gone. You still feel the leg after it's amputated. You can't do more surgery. So that phenomenon occurs in every part of the body. So once the pain is memorized, you actually can't get rid of it. You have to literally program your brain around it.
Reprogram the brain.
Reprogram, correct.
Right. So is it possible to do that? How long does it take to do something like that, to reprogram the brain? Do you replace it with something?
Well, it doesn't take very long. It depends how engaged you are. And what happens is that we get these thought patterns that become embedded in our brain. You can't get rid of them. If you try to fix them, it's a problem. So it's all based on what's called neuroplasticity. So in medical school, we thought the brain was static, that you would only lose brain cells as you get older. It turns out that the brain changes every second. So every second that we are alive, your brain's changing function, new cells, new connections. And so what you're doing, your brain will develop wherever you place its attention. So, for instance, one of the most effective things that we've seen for chronic pain is we simply say, stop, quit discussing your pain. Okay. So what happens is if you want to discuss your pain, go on this endless quest for it, from a neuroplasticity standpoint, you're actually reinforcing those circuits.
So if you stop discussing the pain, what do you do instead?
Well, the first step, I was in chronic pain myself for 15 years. I had no idea what happened. I went from being a fearless spine surgeon to crippling anxiety in about 10 minutes. And once that happened, I could not put that back in the bag. I was absolutely crippled with anxiety for 15 years, with the last 7 of those years being really intolerable. But what happens, we now know that anxiety is an inflammatory disorder. In other words, what happens, anxiety just says danger. And what happens, part of the danger signal is your immune system fires up, and you have what's called inflammatory cytokines turning on this switch. And cytokines are small proteins. They're about 120 amino acids long. They're little proteins floating around the body, and they signal between cells. They signal from every cell in the body has cytokine receptors on those, and then they're little switches. And there's trillions and trillions and trillions of them. So there's 50 trillion cells in the human body. These cytokines are much more numerous than the cells. So every cell has cytokine receptors. So it turns out what happened back in 1990 when I had this panic attack, it was a cytokine storm.
That's what is. So I had never really thought about anxiety being an inflammatory disorder.
Be honest with you, I hadn't either until about 2 months ago. I mean, honestly, we started this whole process of chronic pain. We ran into the COVID epidemic. It turned out to be the approach to solving COVID is very much similar to the approach of solving chronic pain. So we have watched over 1,500 patients go to pain-free, and it's basically calming down the nervous system, calming down the inflammatory response, and it can happen within weeks to months. It's not very hard to do.
Fascinating.
And so you can, once you calm things down, it's unbelievable. So, I mean, doctors don't like treating chronic pain, and I was one of those people because we don't know what we're doing. We never were trained this way. So what happened, a patient walks in the room without, quote, a problem. Now they have this term called medically unexplained symptoms, which I really object to because your whole body's inflamed. There's absolutely something wrong. And just because you can't see it on a test doesn't mean there's not something wrong. So your whole body inflammatory system is on fire. You're under threat. And so it's basically threat versus safety. What the process is of solving chronic pain, and by the way, COVID, is allowing people to feel safe.
COVID is, how does that work?
I'm sorry?
How does COVID allow people to feel safe?
No, to solve it is allowing people to feel safe.
Oh, yes, true. To solve it is.
The solution is the same approach, which I'm not saying they're exactly, actually they are very similar because they're both inflammatory responses. And remember, when you have threat, your body's going to go on fire. In other words, it says danger, including your immune system. So basically in chronic pain, as you learn how to calm down your immune system, pain disappears. Same thing with the COVID. As you do things to drop down these cytokines, you're safe. So it doesn't necessarily stop you from getting the virus. So the virus isn't the problem, it's that inflammatory response to the virus.
Okay, so does the fact that you're wearing masks and protecting yourself more, maybe staying at home more, calms the inflammatory response in the body?
No, that's two different things. So that stops you from getting the virus in the first place. So there's the virus. In other words, if you get a common cold, that's a virus, and they have an inflammatory response that's not that severe, so people don't die from the common cold. The problem with COVID, the virus goes to receptors in the lung and in the heart area. So the inflammatory response is particularly severe there, also other organ systems, and you've heard about the tongue and the nose. So the receptors for the virus are in critical spots, is number one. Second of all, it enters an area where it affects blood pressure. It's called the ACE2 system. It's a blood pressure system. So these little spike proteins go right into these receptors around the heart and the lungs, and that's why the inflammatory response is particularly deadly, because it happens in the lungs. So when I say inflammatory response, the virus comes in the body. That's called an antigen. Then the body mounts a response to get rid of it, the antibodies. So you have these little T cells, B cells. In other words, white blood cells come in different forms. They attack the virus and get rid of it. That's the inflammatory response.
A healthy one. Mm-hmm.
The healthy one. And even the COVID response, by the way, is healthy. It just goes too strong for too long. So you want an inflammatory response to the COVID virus, but you want to keep that cytokine level or the inflammatory response below that critical threshold where people die. So the problem with COVID is not getting the virus, is, of course, dying. And there's ways to stop that too.
So, okay, let me ask you quickly, though, about inflammation and anxiety. Does the inflammation precede anxiety, or does the anxiety precede the inflammation?
It actually goes both ways. But let's talk about where the anxiety precedes the inflammation.
Mm-hmm.
So let's think in terms of threat versus safety. So threat can be a virus or bacteria. It could be a bully. It could be an angry boss. It could be worried about the COVID epidemic. So anxiety is simply a threat. Emotions, unpleasant emotions, are a threat. What's even a bigger threat, by the way, are repressed emotions. Because what happens, your body takes a lot of energy to keep these under wraps, and then your immune system's on fire all the time. So there's 4 areas that cause anxiety. One of them is, that stop anxiety. One of them is a sense of control. Other one is optimism, a positive mood, and the other one is social connection. All of those decrease anxiety, particularly a sense of control. So when you lose control of something, why then your body says danger, then you have this inflammatory response. So that's the basis of chronic disease, of heart disease, Alzheimer's, Parkinson's, blood pressure, etc. The aging, that all occurs because the body's inflamed, and these inflammatory cells are literally chewing up the tissues. And so, again, the anxiety is a threat. So the mental threat versus physical threat, they're processed the same way. The problem that humans have compared to other mammals is that we have consciousness. Thoughts create the same inflammatory response as a physical threat, but you can't escape your thoughts. The COVID epidemic is particularly bad because probably the ultimate way to create anxiety is uncertainty.
Mm-hmm, mm-hmm. And you hear that every other commercial.
Right.
These
so
uncertain times. Yes.
Right.
Mm-hmm.
And then so that creates anxiety.
Mm-hmm.
And it's a long story behind that, but probably the classic way to create anxiety is not knowing the end point.
Mm-hmm. Uncertainty. Mm-hmm.
Right. And then the other thing, of course, we hear the news where they're really fanning the flames. It doesn't help.
Mm-hmm.
But yeah, it's so we have all sorts of things. Then the other thing we have this is all regulated through what's called the autonomic nervous system.
Mm-hmm.
So it's called the vagus nerve, where you have the sympathetic nervous system that goes fight, flight. Then the parasympathetic system actually calms things down. So what's happened was called the polyvagal theory, put out by Stephen Porges years ago. And Dr. Porges, by the way, is part of our think tank, is that every animal, when they see another animal, it says danger. That's the first thing that happens. And what's happened in humans is that part of this vagus nerve is connected to the facial muscles, which allow you to decide whether I'm safe or not. So it calms you down to have social interaction. Those are all connected to the facial muscles, etc. So what happens we actually evolved as humans through social connection. That's how we develop language, interaction. That's why there's such a deep need for social connection, because humans that cooperated with each other had a higher chance of surviving. So we have the uncertainty of the virus, and we don't know when it's going to end, and then we're lacking social connection. And as Dr. Porges puts it really simply, we simply dysregulated the autonomic nervous system. So what happens now, you have a sympathetic fight response, and we see people not getting along or violence. Is not completely their fault, because their vagus nerve has been dysregulated. The controls that are usually in place are not there. The unconscious brain, by the way, processes about 20 million bits of information per second.
That's a lot.
The conscious brain processes 40. It's 20 million versus 40. So
wow.
You know better. So people act violently.
But it takes
it's
over.
Not completely their fault.
It takes over. The subconscious mind takes over.
Correct.
And so this vagus nerve, is it located in our face?
So it's one of those called a cranial nerve. Mm-hmm. So most nerves to the body come off the spinal cord through the little holes in the side of the spine. The cranial nerves come right off the brain. It's called the brainstem. So there's 12 of those, and the vagus nerve is the 10th one of those. So it goes down to the stomach, the organs, bladder, etc. Also goes to the immune system. And so it communicates to the brain, also to the rest of the body. Then if there's danger, those vagus nerve cells directly stimulate the cytokines.
Okay. So that's what causes the inflammatory response to go over the threshold. The cytokine storm is when the inflammatory response goes over the threshold, those particular proteins.
I'm sorry, and just to be technical, I'm sorry, what turns the inflammatory process on is the sympathetic nervous system.
Okay.
The parasympathetic is what causes it to calm down.
Okay.
So,
now, you, as a part of this think tank, you had the experience of having COVID. Do you know how you got it?
No, I got it early before there's any known real exposure. I mean, I traveled to airports. I had not been around people that had it. Of course, it was hardly around. I didn't think I had it, and my wife hauled me off to the doctor, and sure enough, I had it. So I had relatively mild symptoms. I was better in about 5 days, and I probably got it at the airport, and that's all I can tell. Obviously, maybe on an airplane also.
Sometime around January?
I got it in March 10th is when I tested positive.
Oh, not so long ago. Okay.
And, then I was, again, 4 days sick and another day. So my symptoms were fatigue and mild fever and just incredible fatigue. That was basically my symptoms.
Now, did you have stress or anxiety around that, or did you specifically keep yourself calm when you had a fever?
Well, life is very humbling. So I found out if I don't practice the things I teach my patients, I get sick. It's a lot easier to teach this than it is to practice it. So, if I was surprised I got it, but, and I've said this for years, I mean, we actually know this in research, is that when you're under stress, people get sick. So we know chronic stress creates disease. Again, I didn't realize about the cytokines, honestly, until about 2 months ago. So I want to, first of all, give credit to my think tank partners who, I did organize a think tank, so I'll take credit for that. But Dr. Stephen Porges is brilliant, and he, again, has been doing the research on this for 40 years. I don't have anywhere the depth of his knowledge. The other person is Dr. David Clausen, Dr. Clausen, who is a physiatrist in Seattle, has an unusual capacity to put threads of knowledge together, clearly to medical school and college. And we're just fascinated at it. So having Dr. Clausen and Dr. Porges in the same room is really where this came from. But I honestly didn't know about cytokines until 6 or 8 weeks ago. And I had read Dr. Porges' book last December. And so between the polyvagal theory, and what Dr. Clausen wasn't aware of is Dr. Porges' polyvagal theory. And Dr. Porges wasn't really aware of the cytokines like Dr. Clausen was. So putting those two in the same room has just exploded my knowledge. So I just have to give complete credit to these two. I think
that's interesting.
I think my contributions, in fact, I can talk to you and translate what they're saying because I can barely follow what they're saying.
Yeah, that's great. We need a translator. Yes, this is good. This is good.
So I really honestly want to give them credit. So I'm excited because I've learned a lot. I feel like I'm back. Honestly, I've not learned this much since medical school. The last 6 weeks have been unbelievable.
That's fascinating because you went through the experience and now you're learning about the cytokine storm. And actually, if you link it back to the whole amount of people that are dealing with depression and anxiety in our country alone, you have that is a perfect storm combination.
Right.
Chronic pain, anxiety, inflammation equals immune system cytokine storm, which can then make you extremely susceptible to the harsh reactions from COVID.
Well, it's even one step deeper than that because what happens when the cytokines, for instance, are on fire, it doubles the nerve conduction, so you feel the pain. So that's what I'm saying. I segued here a little bit. There's this term called medically unexplained symptoms, and it's just not true. So most patients that have chronic pain are not believed by their doctors or their families. They are extremely trapped. Remember, we talked about that one way to cause anxiety is lack of control. The way to solve anxiety is regaining control. So that's the essence of the Doc Project, is it allows you to be aware of your mental state which causes anxiety. Then there's tools you can use to switch directions. And you literally can program your brain to work in a different spot. So a combination of calming down the inflammatory response, reprogramming your brain, and it's based on neuroplasticity. Chronic pain is an extremely solvable problem.
That's great news. That's fantastic news. All right, we're going to take a quick break, Dr. Hanson, and we're going to come back. We're going to continue on this conversation of the link between inflammation and COVID and what we can do about it. We will be right back. You're listening to Coast AM. Welcome back to Coast AM. Just wanted to let you know that I have a new show on Free Speech TV. And if you go to the website, which is theawareshow.com/Free Speech TV, my guest, Dr. David Hanson, is on there right now. It was an interview that I did with him a couple of weeks ago, and you can go check that out after the show. So you can go to theawareshow.com/Free Speech TV, and you can see the video interview that I did with David Hanscom as well. Really great interview. He talked all about his experiences with COVID and about his think tank as well. So different style of interview than this, but it really is eye-opening and talks a lot about pain too. So visuals, all sorts of things you can see there. So check that out, theawareshow.com/Free Speech TV. And we will be back with David Hanscom Live. I'm Lisa Garr. You're listening to Coast AM. Welcome back to Coast AM. My guest is Dr. David Hanscom. He is a spine surgeon who no longer does spine surgery because he helps people get out of chronic pain by addressing inflammation, which is really the basis of chronic disease, and also he found to be one of the bases of COVID-19 through his think tank that he's talking about with several other doctors around how to calm the inflammatory response, or the cytokine storm, as they're known as, before they get out of control. So, Dr. Hanscom, if you are in a situation where you are maybe have a fever or have some symptoms that might be COVID related, other than getting a test and getting as quickly as you can to a doctor, what is one of the things that you should do mentally and emotionally in that situation?
Well, I wrote a little pamphlet on my website, backandcontrol.com, where there's 10 different categories of things you can do to lower your cytokines. And so the problem is that the people that are dying from COVID have these elevated cytokines, and if you can lower those before you get sick, it's a big deal. And so one of those tools is called expressive writing. It's an unusually simple, effective treatment. You simply write down your thoughts and you tear them up. And it's been the one thing that actually starts all my patients healing chronic pain. It also has been documented to decrease the viral load. It actually decreases inflammation. It doubles skin healing. And it's been documented in over 1,000 research papers to be effective, and it could not be a simpler intervention. So that's the starting point with chronic pain, also one of the starting points for preventing COVID from being a problem. And I think one of the reasons people have a hard time doing it because they can't really believe something. I mean, chronic pain's bad. Obviously, the COVID virus is bad. And people think, well, how can such a simple intervention such as expressive writing calm down my inflammatory response? But it's remarkable.
That is interesting. And also you have expressive art therapy.
Right.
Tell me a little bit about that.
Well, what happens, again, remember, it's threat versus safety. So if you can get your brain on pathways that are engaged in something enjoyable, now you're feeling safe. And so instead of having adrenaline and cortisol, you have oxytocin, the anti-inflammatory cytokines, and your whole body just calms down. But art therapies are a tremendously beneficial thing to do.
That's wonderful. I mean, those are things that you can do at home just to calm the process. If you're, not feeling well, or even in the time we're in where we're under quarantine, doing art therapy is a great idea for that as well, or expressive writing is a great idea for that as well. All right, so let's talk a little bit about the process or the purpose of the think tank. Are you going towards a solution of maybe lowering the rates of COVID or the spikes? Can you tell me a little bit about the goal there?
Well, what's happening, again, with Dr. Porges' work with the polyvagal theory, so we basically have an approach that will work. In other words, we feel like we have an approach that actually will solve the pandemic. And it sounds like a big statement, but it's basically using things that are available now, not fancy vaccines. But, for instance, covering the basics is where we start. And it's similar to chronic pain, by the way, where there's a bunch of things that solve chronic pain. There's a bunch of things that can solve the COVID. So we know, for instance, vitamin D is the number one vitamin deficiency in the country, actually in the world. And so you need vitamin D to actually There's a cell called a monocyte that kills the virus, but you have to have vitamin D to make that work. So, for instance, one reason African Americans are dying more from the COVID virus is that they have lower levels of vitamin D. Because of their skin color, they're competing with melanin to convert vitamin D to an active form. So people with dark skin have less vitamin D. They have less capacity against the inflammatory response. In other words, you have the virus, you got to get rid of it. You need vitamin D to do that. So things like having adequate vitamin D, vitamin C, vitamin B, vitamin K, basic things. Then zinc is a big one. Many elderly people don't have zinc in their system. And magnesium. Those are all required to help the enzymes work to actually kill the virus. So the first step is just covering those bases. And for instance, there's a paper out of Germany that shows just with vitamin D, the mortality rate just dropped through the floor. Well, again, if you combine all of these basic treatments into one protocol, it's game on.
Would you suggest a multivitamin, or is there a specific amount of each one of those?
Well, I think the vitamin, I honestly don't know the answer to that question, but, vitamin D is 10,000 units a day, so I don't know if there's a vitamin that actually provides those levels of what you need. So basically the zinc, magnesium, and then basically B, C, and D. And it's interesting because basically blacks have levels of vitamin D that are low, but they don't have osteoporosis, which is broken bones. African Americans don't have bones that fracture, but their vitamin D levels are lower, so that'll affect their enzymes, but not their bone structure. It's interesting. But anyway, so covering the bases is really critical. And then the second thing is it's just doing things to engage the parasympathetic nervous system. So we think that when you're in the ICU, there's some case reports of this one radiologist whose daughter was very ill, 12-year-old daughter actually died twice. And what struck our group is that she probably shouldn't have survived, but her mother was a radiologist who was able to go in there and hold her hand. So human touch downregulates the sympathetic system, it upregulates the parasympathetic nervous system, and calms down the cytokine response. And probably the reason why this girl lived was because her mother held her hand. So, under adequate protection, one of the things we think that should be done in the ICU is actually having relatives in there, obviously with precautions, to have the physical touch.
That is important in a way that would, if you could do it safely, or if you could do it in the environment of a surgery, that's something to work around.
Right.
But possible. But that does make sense. So what we're trying to do is you're trying to upregulate the parasympathetic nervous system, the one that calms you down, and downregulate the sympathetic nervous system, the one that makes you anxious. Okay. Anything that does that.
Right. So we came up with what's called a Plan B that's a little complicated, but looks at the virus load, looks at the inflammatory response, looks at what's called angiotensin, which is a very strong it's very inflammatory. So there's probably 20 other medications that are safe, low risk, that when you combine them will be effective. We've seen studies all over the world that each one of these interventions by themselves has been effective. But the key to chronic pain is that everything works a little bit in chronic pain, but nothing works in isolation. So with the COVID, it's the same thing. Is when you combine effective modalities, it's going to work. And so we put the protocol out last Friday. We've been working on this very hard. There's a couple things that we're still unsure about. For instance, ketones. You've heard of intermittent fasting by chance? Mm-hmm. So the effect of inflammatory markers, by the way, is dramatic. And so what you're doing, you're pushing your diet from sugars to what's called ketones. And viruses don't like ketones. In other words, it's a very, very strong anti-inflammatory agent. It's also an antiviral agent. So one thing that's being researched out of Baltimore right now is they're looking at using ketones instead of sugar because viruses love sugar. They don't like ketones. So again, another intervention that can make potentially a big difference.
And so intermittent fasting is, is it a day on or 2 days on, or how do you categorize intermittent fasting?
Well, I started this. I read the data. It came out in December. a big review article. I mean, it's been known for a long time, and I have to tell you that surgeons are not the best nutritionists, so I'm going to
Right.
take
It's
a little
not.
bit of a pat. But I will tell you, I read this data, I go, my goodness. So under eating, in other words, lower caloric intake, plus this intermittent fasting drops the inflammatory markers through the floor. It's unbelievable. Every paper, every time. So you can fast 2 out of 7 days, with the fasting days being between 500 to 1,000 calories on those days. Or what I'm doing, I'm skipping breakfast, which you eat your calories. In other words, you fast for 16 to 18 hours a day. I get to about 14 maybe before I eat. And I have arthritis. I'm not very happy about it, but my pain's down probably 60%. And the arthritis to me has always felt in the capsule around the joints, not in the joint itself. And so, again, you're dropping down inflammatory markers, dropping down pain dramatically, and it's impressive. But just from an aging disease standpoint, cancer goes down, different degenerative diseases go down, aging drops down. And the human body evolved not eating 3 meals a day. And so historically, people have used their fat stores. In other words, when you don't have glucose, you're taking the energy from your fat cells and creating what's called ketone bodies. And the body likes ketone bodies as a regenerating type fuel.
So if you don't have the food intake, then why would the body use the fat stores? Wouldn't it use the glucose stores?
Well, I mean, what happens was glycolysis. No, so glucose is what we use to run our brains. We use it to run, jump, just do normal activities. Is basically glucose. So fat is stored as the reserve fuel. So there's called glycogen, which is how sugars are stored. And again, cortisol is what cranks those up to increase the glucose. So for activities that are relatively sudden and whatever, why you go to glucose. But if you don't have the glucose, again, the fat is the next source. And of course, if you're out of fat, then you start losing protein. That's why people, when they starve to death, they start losing muscle, of course, too.
Right.
So your protein we use also, but no, that's what fat is for, is that we don't have access to your food or the sugars, then the energy comes out of the fat cells.
Okay, so that means you can't have sugar. Then it goes right to the fat cell burning.
Right.
Gotcha.
And the number one inflammatory thing that we have in modern history that's never been around for centuries is sugar.
All the sugars, yes.
Right. It's a problem. And again, I'm a diet nihilist, and this data is so compelling.
Right. So the hours that you do eat, you can't have sugar because that would be the first thing that's burned, which would eliminate the whole point of having the ketones or the inflammatory response going down. Basically,
so
that's great. The markers.
I'm going to rationalize here because I can't quite do that. So my sense is that it's that 16, 18 hours of fasting where I just have a cup of coffee. That's about it. A little bit of sugar in my coffee. And then when you eat, you can, as far as I can tell, and again, the nutritionist would probably kill me on this one, but you can have sugars. I mean, some. You want to still have a decent diet.
Maybe fruit sugars.
Yeah, you can, fruits, vegetables. You can have some sugars. It's just that you're just dropping off these loads of highly processed foods that we eat all the time. So I'd say a reasonable diet when you're eating. It also has to be sustainable. And so when you do eat, you want to at least enjoy what you're eating.
Yes. But the point is, if you're looking at chronic pain, if you have any type of depression or anxiety, if you are working out in the essential working field and you're constantly susceptible to this virus, one of the best things that you can do to drop the inflammatory markers, that's the whole point here, is this intermittent fasting and increasing the vitamins B, C, D, E, zinc, and magnesium. That's the plan B that you're talking about, the protocol.
Well, it's plan A and plan B. Plan A is what you can do on your own, flat out, to drop down the cytokines before you get sick. So things like not watching the news all the time is one of them. And again, that is a threat. Sleep, the expressive writing, forgiveness. If you're angry, your cytokines are through the ceiling. Exercise, etc. Play. So those are things you can do. So when the cytokine load hits, when it goes up and stays below that critical threshold, the plan B is once you get sick, medically your doctors can put together a protocol that can save lives. And so we've seen it. Our concern isn't that it's going to work. It is a different approach, looking at the polyvagal theory. Looking at the lens of the polyvagal theory, it is a different approach. But again, look at the data from the world and look at the approach of the polyvagal theory. It has a potential to stop the pandemic.
If we actually calm down and actually spent a little bit more time doing forgiveness, a little bit of art therapy, a lot more movement, it definitely could make humanity a lot more healthy. When you came down with this fever, did you calm down? I mean, I know you slept because you said your energy was very low, right?
Well, sleep makes a big difference. For instance, we know in chronic pain that lack of sleep actually causes chronic pain. It's interesting. And now we know lack of sleep actually elevates cytokines. So I purposefully just slept and slept and slept. I did my expressive writing, worked on, there's always some stress in life, so I worked on realizing that I was under a little bit more stress than I would admit to. And so I did practice the tools that I, teach my patients and people that are listening to me. But, yeah, I got through it pretty quickly. And probably sleep, hydration. I wasn't eating much anyway. But
right.
And I didn't really start the anti-inflammatory. I started the anti-inflammatory diet about maybe 8 weeks ago after I read this article again. So when I got sick, I had not been using the anti-inflammatory diet.
Ah, interesting. So then you did that and you got healthy during that experience.
Right.
And then did you have any pain in your body that actually also subsided during that time?
No, I mean, I had a lot of deep aching. I mean, it was incredibly fatiguing and aching. So I felt like I had a fever of about 103, but I really didn't have a fever. I guess it's one of the cardinal symptoms of the COVID where you feel like you're really sick as far as the fever, but it's always a low-grade fever. Some people have had high-grade fevers.
It does. The chills and everything happen, but you don't get an actual temperature reading of a high temperature. It's very strange.
Right.
That's the body going into that response of massive virus must protect.
Right.
Yeah, and then if you give it that assistance. So, this is great advice anyway, to find ways to stay and remain calm and to your point of having some sense of control, create a routine for yourself that you can stick to, because human beings ultimately like structure loosely, to find sources of optimism by reading or consuming material that puts you in the optimistic space, positive mood, and some social interaction and connection, which can be done virtually, which is fine as well. There are many different types of ways to do that. And those types of things can actually, you've found, boost the immune system.
Right. But there is a catch-22.
Okay.
I learned about this week is that, so when you're angry, you actually feel safe. And what I learned from Dr. Porges is called a vagal stimulator, which is part of this Plan B protocol, that in clinical care, you have somebody who's in chronic pain, depressed, frustrated. The vagal stimulator actually works and calms people down. People don't tolerate quiet. They don't tolerate peace. They become incredibly anxious. So the anger is actually part of the disease that actually blocks the treatment. So we talk about, good music, good art, let's not watch the news, etc. Well, people are used to being agitated. There's actually a study in the brain that shows that there's a pathway between two parts of the brain that if you have this pathway, you basically have a 100% chance of getting chronic pain. Then there's also dopamine involved. So it turns out that anger is a true addiction. People become addicted to their pain, but it's not their fault.
Anger is an addiction. That's fascinating. All right, we're going to talk more about that when we come back with Dr. David Hascom. Welcome back to Coast AM. I am Lisa Garr, and thank you so much, Michael, for playing that. Peace of mind, that is what we need, and we have got a theme going in today's show about a peace of mind. Speaking of which, have you ever experienced Paranormal Date? Paranormal Date has over almost, I think, 90,000 users at this point, and it's very exciting because you can find like-minded people to have a like-minded conversation with, even if it's just over Zoom. So you can check that out on the Coast to Coast AM website and find someone to connect with, because that is what we're also talking about, and as well as peace of mind, is connection, human connection. All right, we'll check that out on the Coast to Coast AM website, and we will be right back with my guest, Dr. David Hanson. I'm Lisa Garr. You're listening to Coast AM. Welcome back to Coast AM. I am Lisa Garr. My guest is Dr. David Hanson, orthopedic spine surgeon, helping people in chronic pain. We've been talking about the relationship between chronic pain, anxiety, inflammation, and COVID, and that there's many ways that you can truly reduce the inflammatory markers known as the cytokines through things like finding a sense of control, optimism, positive mood, social connection. And we were talking about, before the break, anger, and how anger is an addiction and can cause inflammation. And so if you could talk a little bit more about that, David, about anger being an addiction. What do you mean by that?
Well, remember, it's basically threat versus safety. And so if you're threatened, it basically is fight, flight, or freeze. So the first impulse is to fight. And interestingly enough, that's an anger response, right? So if you actually fight and win, in other words, you get control, your inflammatory markers go way down. They've done studies in kids who are bullied, and they found out that kids who are bullied have very high inflammatory markers, but the bullies actually have lower inflammatory markers. So there's actually a physiological reward for gaining control. Unfortunately, most of us can't gain control, and of course, even if we could, it's not a very happy life. But the bottom line is that the first response to threat is going to be basically fight or anger. So what happens, you get, and actually what got me in trouble, by the way, I was in chronic pain for 15 years, is that one way of actually being angry is being a perfectionist. And so remember, there's a sequence of anger, which is circumstance, blame, victim, anger. So you're always a victim of less than perfect, or you're less than perfect. So you're always a victim of less than perfect, and you're always frustrated. So believe it or not, perfectionism is actually the most common form of remaining angry, which again fires up your immune system, which again, for me, got me in deep trouble.
Interesting. So in a way, it is a sense of control, but that doesn't use the perfectionism and lead to the rigidity that control could actually, that's kind of the downside of it, right? It has to be. So what would you suggest that would be loosely a sense of structure?
Around the anger?
Yes.
So you have to allow yourself, so it's a learned skill, you have to actually allow yourself to feel safe. In other words, feel vulnerable.
Okay.
Remember, vulnerable is anti-survival. And so as you use the tools like expressive writing, remember, anxiety is physiological. It is not psychological. So it's an inflammatory response. Body chemistry is on fire. And so the first thing you have to do with anxiety is simply separate from it. So something creates anxiety. You control the situation. Anxiety goes away. When you lose control, you kick in more stress chemicals, and you become angry. So anxiety and anger are the same thing.
Ah, wow, that's a big statement. That's a big statement.
And then so when you're angry, you may not have control, but you feel like you're in control. So in other words, anger feels powerful, whereas anxiety is vulnerable. And that's where it's a learned skill simply to, if you're going to decrease anxiety, simply going to decrease your stress reaction. So that's where the writing comes into place, better sleep, meditation, relaxation, breathing exercises, all these things simply drop the stress chemicals because anxiety is a sensation generated by those chemicals.
Fascinating.
So again, it's 20 million to 1 ratio of 20 million bits of information per second for the conscious brain versus 40 for the conscious brain. So talk therapy is not going to work. Plus, you don't want to get rid of anxiety because you wouldn't survive. I mean, anxiety is a gift. It's how we evolved. It's how we survive. So the goal is not to get rid of it. The goal is to learn to live with it. And once you can train your brain to not need to control, in other words, you learn to be vulnerable, train your brain to do it, then you're safe. Remember, humans can't escape their thoughts. A lot of our thoughts are cognitive distortions. So once you understand the whole process based on awareness, then you separate, then you reprogram, you actually change the physical structure of your brain.
So now that's you said that twice, separating from it. So I understand that if you want to feel vulnerable, you have to do it in a safe environment in order to calm down the inflammation. But how do you physically separate from anxiety if it's a physiological response?
Well, a couple things. I mean, first of all, the expressive writing, we think that's why the expressive writing works, because these unpleasant thoughts, by the way, are the most common reason to create anxiety. So the thoughts are on the table. There's now a space between you and the thoughts. So that's awareness and separation in one step. And then reprogramming can be play, a little meditation exercise, relaxation. So you don't want to do the play and relaxation as a distraction from the anxiety, because that's not going to work. But somehow the writing exercise is that key that starts the whole process. Every person that's gotten better, almost without exception, has always started with the expressive writing.
Okay, so that is a great point. You can get a journal and you can just start. Is there a specific way that you suggest expressive writing, or can you just start to journal?
Well, the research is done mostly on writing down negative emotions, but it actually doesn't matter. So the key issue is that you have to write down your thoughts, free thinking, and then you have to tear them up. Now, you're tearing them up for two reasons. One of them is to write with freedom, but the other one is to not analyze the thoughts because your brain's on the thoughts. In other words, you're reinforcing the thoughts instead of separating. So it's just an exercise, anywhere from 5 to 15 minutes, once or twice a day. Simply write down your thoughts, tear them up, throw them away. After 15 solid years of chronic pain, within 2 weeks after I started the writing, somewhat by accident, my symptoms started to shift. Of course, being a surgeon, I had access to every treatment you can imagine, and I tried them all, and I kept getting worse and worse and worse. Within 2 weeks after I started the writing, things started to shift. By 6 weeks, a big shift, and by 6 months, I was fine. I have no symptoms. I went from 17 physical symptoms to none, and I'm still that way 15 years later.
By addressing the anger.
Right, which I didn't know I had, by the way.
Which you didn't know you had, that then helped the anxiety.
Right. So what happened, I didn't recognize perfectionism was angry, because, I mean, surgeons tend to be very self-critical. A negative voice is always there. We sort of become successful by driving ourselves really hard because we're not good enough. So that's a major drive to be, quote, successful. It's the same adrenaline drive that takes you up the hill, that takes you right down the other side. So, again, huge issues in physician burnout, which is another topic. So I had the classic burnout, and it was a disaster, very humbling. I honestly, one reason I'm so passionate, I don't want to be negative in the rest of the medical profession, because none of us are trained in chronic pain. We just aren't.
It's a tough one. It's definitely a tough one. Well, there's a link, though, here between chronic pain and anxiety and anger and inflammation.
Right.
I'm going to go to our callers here. Mike in Denver. Mike has a question for you. Hi, Mike. How's it going tonight?
Hey, Lisa. Thank you so much for taking my call. It's so great to talk to you again. I was just talking to Gina. I've been watching your show on Free Speech TV, Becoming Aware, and I really enjoy it. You have some great doctors and guests on there, and it's really been helping me through this time. So thank you.
Bless you. Thank you so much, Mike. That's wonderful to hear. That is great.
You.
And you have a great question for Dr. David here.
I do, yeah. Dr. Hanson, it's such an honor to speak with you. I had a question regarding the psychological effect on chronic pain. So when we talk about chronic pain, and especially lumbar and back pain, I feel that a lot of it can be a psychological type of thing where we can think of having the pain, so to speak, and cause it. How much of chronic pain do you feel is due to psychological reactions? Thank you.
So I like to get rid of the word psychology completely, just look in terms of threat. So the reason I don't like the word psychological, because we have consciousness, which is not nearly as strong as the unconscious brain. So the key issue here is to understand that you have threat versus safety, and you have to calm down your whole body. So it's not mind over matter. And the problem with the word psychology, why I react to it, because in medicine, somebody comes in with back pain, everything looks fine, we can't see the problem. So we send people to the psychologist, and it's not the place to go. Almost every patient I've gotten better has never seen a psychologist. Now, I like psychologists. It's better if you have one. They can give you support, wisdom, and guidance. But this is not a psychological issue. This is an inflammatory process.
Interesting. So how is anger not a psychological issue?
Well, again, anger represents an elevation of the body. So you can have there's mental threat versus physical threat. So I like the word mental threat. And so if you can control the mental threat, your anxiety drops. Remember, anxiety is the reaction. Anger is the reaction. It's not the cause. So you have something that threatens you. You become anxious. You have a neurochemical response, which is inflammatory. You control it. That's how people survive. In other words, the sensation generated by this reaction is intended to be so unpleasant that it forces you to take action to solve it. That's how we survive. It's a survival sensation. So anxiety is just a sensation generated by this total body response. If you can't control it, then your body kicks in a higher level of inflammatory markers, et cetera, and you become angry. So then your body's really on fire. Dr. Sarno years ago called it rage. When you're trapped by anything, whether it's pain, finances, relationships, et cetera, with no way out, i.e. the COVID epidemic, people become really upset, and Dr. Sarno again called it rage. Then your body's really on fire. Then paradoxically, as you are justifiably angry, then your body becomes physically damaged. So there's over 30 physical symptoms from ongoing anger, including autoimmune disorders, hypertension, cardiac disease, Alzheimer's, Parkinson's are all inflammatory disorders.
Well, that's interesting. So, yeah, this could also have to do with the state that we're in terms of the virus having an opportunistic moment or hosts in order to expand on because of unresolved anger and with the state of our world.
Right, absolutely. That's exactly dead on.
And thus protests. All right, so let's, great questions here. Let's go to Joe in Lakewood, Ohio. Hey, Joe, how's it going? First-time caller.
Hi, Lisa.
Hi.
Thanks for taking my call. I had a couple questions.
Yes.
The first question, I wanted to know if the doctor was familiar with a blood test. It's called a TGF beta 1. It basically shows intercellular death and cytokine response. I'm a neurocompromised. I had the COVID, and I was able to get through it. But I've been neurocompromised for about 6 years. I have I have a blood-brain barrier was compromised, and this COVID. I'm 100% convinced. Obviously, it was a man-made thing, and my concern is what's going to happen is with this 5G, and because that's really going to cause a cytokine response. It's going to really put us in a fight or flight. That's what I feel almost 24/7.
Are you familiar with that type of test, Dr. Hanson?
I'm honestly not. I have to probably not answer that question. I just don't know enough about it.
Okay. But are there actually markers in the blood that show inflammatory responses? That's what the cytokines are, right?
Right. So there's a marker called IL-6, IL-1, IL-17. There's TGF, blanking out of the delta on it. But you can actually directly measure the cytokines. So IL-6 is the most common one. They're now developing commercial products for it. Historically, we've measured what's called C-reactive protein, which is a pretty strong indicator, but it lags behind the IL-6 quite a bit. Then the chronic one is called the SED rate, which talks about chronic inflammation. That's very elevated in rheumatoid arthritis and different autoimmune disorders. So there's a bunch of blood tests to measure inflammation, and his may be one of those. I'm just not familiar with it.
That's interesting, though. So you can get a test to find out how high the inflammatory markers are in the blood.
Right. So the first thing you do if you get sick and go to the hospital is actually measure the IL-6 levels. That's one of the big factors we recommend.
Okay. All right. That's interesting. Can you get that test done whether or not you are sick?
Well, it's not why it's becoming more available. I know in Seattle, why the University of Washington has it, the other hospitals do not. So it's not again, I just read a couple days ago they're making it very commercially available to measure these IL-6 levels.
Okay, great. Very interesting. Okay, great. Thank you so much for your call, Joe. I appreciate it. So these types of tests, do you need to order them through a doctor in order to get these types of tests?
Well, I mean, if you're not right, this is a hospital test.
Okay.
I mean, it's nice enough you have antibodies, which I think is great.
Mm-hmm.
But the actual blood test, as far as inflammation, really you measure. In other words, if the IL-6 levels start going up really quickly,
You're more
so
susceptible.
the reason why people die is the inflammation goes too high. You literally drown in your inflammatory fluids. It sounds gross, and it is, but that's what happens. So what you're doing before you get sick is dropping the IL-6 levels or cytokine levels, and then the cytokine rise, they call it the cytokine storm. It may not be a storm at all, maybe the normal cytokine response, but if you start with high cytokines, which are high in obesity, hypertension, etc. In other words, all these people that are having trouble surviving COVID have pre-existing conditions, but all those conditions have elevated inflammatory markers.
Okay. And by the way, does something like CBD help with those types of immune system responses?
Yes. So a friend of mine, Jim Taylor, runs a clinic out in North Carolina, and I just had him on my podcast. And the cannabinoids are extremely promising for both sleep and anxiety and inflammation. And the only problem with them now is we don't know the dosing exactly which formula is best for which. He's actually hired a molecular biologist to keep figuring this out, but they've had nice success dropping people's pain down, inflammation down. CBD is actually one of those anti-inflammatory medications that's possible once you get sick to actually dampen the response.
Wow.
So there's a lot of promise. And plus I'm somebody who sort of had a natural suspicion of cannabinoids because in the 1990s, I was one of those doctors who put people on opioids because the world asked us to.
Yes.
And so that didn't work very well. But this seems more promising, is a higher therapeutic range. By the way, opioids are inflammatory. It's an inflammatory response drug, so your brain actually gets sensitized with chronic opioids, where the cannabinoids are actually the opposite.
That's odd. Aren't the opioids supposed to reduce pain?
Well, right. For acute pain, they do work, but for chronic pain, they're really counterproductive. So we're going way away from. I didn't believe this for a couple of years because I put people on opioids, and on low doses they work fine. But I also have people on over 1,000 milligrams of morphine a day, which is a lot of morphine. I mean, normal dose is like maybe 40. But as we calm them down, they actually come off all the medications, no pain. I have one gentleman, by the way, who had 27 surgeries, 20 years of chronic pain, high dose opioids. He's pain-free. He's doing fine.
Wow. That's a huge transformation. That's incredible. Well, that's good news. I'm glad you've done this research, and we're going to actually take another quick break. When we come back, we're going to take more callers, which is always wonderful, and get your questions answered. We will be right back. You're listening to Coast AM. Welcome back to Coast AM. I am Lisa Garr, and once again, I want to remind you, if you want to check out my show, it's on 5 days a week on Free Speech TV. And if you go to the website, which is theawareshow.com/Free Speech TV, you will see right there is the interview I've actually done with Dr. David Hanson, my guest who's on tonight. And we did a great interview there, a video interview. You can watch it right now. And it's terrific interview on more conversations around pain and his experiences around COVID. So great conversation there. And Free Speech TV it's a wonderful way to also support public radio and public television and voices that don't have commercials and so forth. So it's a wonderful way to do that as well. So thank you so much for checking that out. We will be right back. You are listening to Coast AM. Welcome back to Coast AM. I am Lisa Garr, and Dr. David Hanson is my guest. We're talking about the link between chronic pain, anxiety, inflammation, anger, and COVID. Believe it or not, they're all related. Did I get that right?
Absolutely. Said it very
Fascinating. Fascinating. I had a question, and then I forgot it. So let's go to callers because that's going to work out better. Let's see here. We've got Carlos in San Francisco. Carlos, do you have a question for Dr. Hanson?
Yes. Good morning, Lisa, and good morning, Dr. Hanson. So I'd like to preface my call by saying that, I did come into the discussion late, and there was a statement that I understood, which prompted me to call, and that was the statement where it seemed very generally that there's this direct relationship between anxiety and anger, and I take slight issue with that. And I understand that the call is, has an emphasis on COVID-19, and my statement doesn't really address the COVID-19 issue, but the general relationship between anxiety and anger that I would like Dr. Hanson to at least clarify for me. So I'll preface it also by saying that there is a condition that sometimes comes from adverse child environments, which is currently known as, or referred to as, complex post-traumatic stress disorder. This is a distinction from post-traumatic stress disorder that we've all come to understand that's in the DSM. Complex PTSD, to my knowledge, is not at this time admitted into the DSM as a diagnosis. And as PTSD refers to a specific trauma-related response to an event versus an overall experience, such as in childhood. And so the reason why I wanted to offer that is because what I've understood through my own journey with complex PTSD is that there is a brain setting that happens that sets us by default in a dysregulation state, or that we're more prone to dysregulation. And so that's significant because what normally would be, interpreted as just generalized anxiety, and then there's a frustration about that anxiety that we turn into an anger response. But when you have an overall dysregulated setting, then you have to constantly, learn different techniques so that you can somehow create some equilibrium for yourself so that you're not always in this prone, anxious state. So and that's what causes the anger.
Right. But you can rememorize another pattern, basically, which is what I believe you were talking about earlier, Dr.
Yeah,
Hanson.
Everything we said is exactly what you pointed out. So adverse childhood experiences are a disaster. Dr. Bruce McEwen literally called it a scrambled brain. And so I had a very high ACE score. I had an extremely abusive childhood. That's what got me in trouble eventually. So anytime you're anxious or frustrated, something in the present reminded you of something in the past. Is how we all survive. So my childhood was dangerous. So things in adulthood often seem more dangerous than it does to other people. So yeah, you're right. When you have a difficult past or an adult experience that's traumatic, it's sort of the same thing. It scrambles your brain. And so, yeah, the trigger is really difficult. And for me, it's challenging because when I get triggered, I'm not perfect. I've learned a lot, and I'm better than I used to be. But it's a learned skill to repetitively create that space, choose a different reaction, and it actually changes the structure of your brain. You can actually reprogram your brain.
Fascinating. So you can, that's what we were talking about earlier about neuroplasticity, is that you can actually rewire the brain through repetition and enough of that. Okay, let's see if we can go to Dave in Albany, New York, in our wild card line 1. Hi, Dave. How's it going?
Fine, Lisa and Dave. Let me just, right out of the box, give something positive for people to do, because if you're never going to get as tense as you feel, especially right now, possibly if you have pollen allergies or anything else, get a bottle of organic peppermint oil and just to put some inside each nostril, and a complete difference in how you're going to be able to relax, breathe properly. It's amazing.
That's a great tip and technique. And your phone, unfortunately, is breaking up, but he said to organic peppermint oil, and there's a lot of wonderful medicinal effects of organic peppermint.
Well, that's an interesting observation because, again, as a surgeon, I still have to gulp. I still am a surgeon, but it's true that aromatherapy actually changes sensory input. It calms people down.
Mm-hmm. Yes. I have a lot of aromatherapy in my office going all the time. I'll have a lemon oil diffusing or lavender or something like that.
Yeah, no, it's great. It
does put me in a really good mood, especially since we're spending so much time in our home offices these days, which is great. Okay, so then Cornelius. How are you, Cornelius, in Louisiana? Do you have a question for Dr. David Hanscom?
Yes, Miss Lisa, I missed you from Louisville, and of course you got Miss Louise from Louisville, the Cleopatra. Dr. David, God bless you. How you doing there? I hope we pray for Mr. Carlos from California. Sound like he had a whole lot of trouble. But my question for you, I'm being an African American, Mr. Dr. David and stuff, and you've been giving us some good information and stuff. I went through some trauma. Gina knows about it, and of course Tommy and George and some of the callers and listeners. As African Americans, we've been through a lot of racism in this country and stuff, and some of it coming up on tape, and it sort of makes you depressed. But I'm glad people are really seeing the truth now. And
yes,
when about 20 years ago, I got death threats and nails put in my tires, and the FBI promised to help me and didn't. And I just found the Bible and Christ, and that's what really helped me out a whole lot. So I don't know if you're a biblical man or you believe in Christ. I found that helps out, but I'm going to use some of your stuff, your writings and stuff like that. And God bless you. And Lisa, we love you and everything. And Dr. David, God bless you.
Oh, God bless you too, Cornelius.
Let me make a big comment here. This is a big comment. So the ultimate shift away from pain, i.e. anxiety and anger, is the spiritual journey. Now, it can come in any form: good food, good wine, good friends, religious experience. So as you move into that realm and get your perspective back, you're moving a long ways away from the pain. Also, giving back, helping other people, put your attention on others, not yourself, and, of course, play. So play, giving back, and the spiritual perspective are actually the ultimate answers to chronic pain.
Wonderful. And I really appreciate that. I'm so glad Cornelius is a listener. That's wonderful. We have a lot of questions here coming in. Mike from Hagerstown, Maryland. Hi, Mike. How you doing?
Real good. How you doing today?
Great. Thanks. Wow. Great voice. What is your question for Dr. Hanscom?
Yes, ma'am. The reason why I was calling today is, as he spoke earlier, it being therapeutic to do a writing for anxiety and things such as like a release. I would like him to elaborate a little bit more. Is that just you're jotting down negative emotions that you're feeling? And if so, what's the best time of day to do that? Probably after the day is you've already, dealt with so much throughout the day, release it in the evenings, or what does he personally recommend? And I'll take my answer off the air, and you folks have a great day.
Thank you. You too. So good time of day for that? That's a great question.
Well, I think everybody does it differently. I encourage people not to overwrite. To me, it's more of a metaphor or represents separation from your thoughts. So I write for 5 or 10 minutes in the morning, and I write for 5 or 10 minutes in the evening. It's been documented that expressive writing helps you get to sleep. And for me personally, if I quit doing the writing exercises, which I do, I'll have to admit that, within 2 weeks my symptoms come back. My ears start to ring, my feet start to burn, the skin rashes pop up. It happens every time. And I got to tell you, the research is very deep on it, but I even still, every person's gotten better, started the writing, has changed my life. There's a certain amount of disbelief. I'm going, wait a second, how can something this simple make this deep of a change? And it does. Every person, every time. It's amazing.
That's amazing. And I think that if you can do that on a regular basis, you'll start to see right away the effects of it rather than... Right. Yes. So, okay, let's go back to our callers here. We've got Wayne in Tacoma, Washington. Hi, Wayne. How you doing tonight?
Good evening. Thank you. Thank you very much for taking my call, Lady Lisa and Doctor. My question is about things that would act as inflammatories, natural inflammatories, anti-inflammatories, rather. Such as, when I broke my back 40 years ago, I had to find things that would help me, and I came across papaya, which has papain in it, and pineapple that has bromelain in it, and those help a lot with the pain and killing that. I'm just wondering if some of the things that have natural anti-inflammatories that are antioxidant, supporting, and also herbs. Are there some herbs you can mention, as well as foods that you can mention that would be anti-inflammatories, like maybe reishi mushrooms, things like that?
Great question. Yeah. Yes.
No, I mean, I honestly don't. I'm not an expert in this area as far as what those choices are. Again, as a surgeon, I used to be very cynical about this stuff. That's changed completely. So there are many anti-inflammatory herbs and oils, et cetera, that are very helpful. I just don't have expertise in that area, but I think that's all good stuff.
Yes, I mean, as you mentioned, with the reishi mushrooms and a lot of anti-inflammatory responses come from the medicinal mushroom families, as well as what we talked about earlier, CBD. Possibly, it depends, but those are good answers. And we've done a lot of great interviews on it too.
You have to emphasize the anti-inflammatory. I mean, you can do these herbs, et cetera, but if you're not doing an anti-inflammatory diet, you're negating everything.
Right. Okay. On to that question. Richard from Alaska. Richard, hi. Do you have a question for Dr. Hanscom?
Good evening.
Hello.
On the intermittent fasting.
Yes.
I studied a nephrologist by the name of Dr. Fong, and he basically asserts in his research that we do not have an insulin problem because the biggest problem is that the doctor wants to give you insulin for the type 2 diabetic, which causes or accelerates the inflammation, accelerates the fat storage, and all that goes with it.
That's exactly right.
So,
wow.
Right. I mean, it's a whole different conversation, but the problem with adult onset diabetes is an inflammatory cytokine disorder. So the fat cells actually produce inflammatory cytokines, which packs more insulin into the cell. Packs more fat and glucose into the cells, and then you develop an insulin resistance from the inflammatory cytokines. So it's a catch-22. That's why the anti-inflammatory diet is so great, because it's not so much for weight loss as inflammation. Of course, weight loss does happen. So that's what I like about the anti-inflammatory diet, is that it happens now. In other words, if you start now, in 2 weeks, your inflammatory markers are going to go down regardless of your weight loss. But that's exactly dead on as far as the problem with insulin actually making it worse. We're packing more glucose into the cells as opposed to helping you decrease the inflammatory cytokines.
Wow, great question. Thank you so much for explaining that. My goodness, who knew? Obviously, that's well known. Okay, let's go to Leroy in Gilroy, California. Hi, Leroy. Thanks for calling in.
Thank you for taking my call. I am a totally disabled Vietnam combat veteran, have chronic pain, and confined to a wheelchair, unable to exercise. How do I get off of the oxycodone so that I can get exercise into my life?
Well, I wish I was in practice. I mean, I have one woman, just for example, who is in a wheelchair for 10 years, 800 milligrams of morphine a day. Within 1 year, she went to pain-free, no wheelchair, and back to full function. So it's a sequence. You can't just come off the medications. That's a disaster. But again, I have this website, backincontrol.com. About 90% of this is self-directed. Most people that got better did not have my help or even input. So it's a sequence that works. I have one woman in 55 years of chronic pain. It's been pain-free for a long time. And so it's a process. It's a stepwise process. But, yeah, don't give up hope. I mean, again, I wish I was in practice now because I would love to work with you.
That is amazing. You're basically saying that you can do this in a self-directed way by going through backincontrol.com, and there's a foundation there. You lay the foundation, you work on forgiveness, you work on writing, you work on a positive vitamin protocol, expanding your consciousness, and you've really had people have success with this.
Yeah, I also do on Tuesdays and Thursdays at noon. I have a 1 hour open question and answer session every week, and it's been wonderful.
Great.
Yeah.
Tuesdays and Thursday afternoons. How does one find?
Yeah, 12 o'clock noon Pacific time.
And how do you find out about that?
And it's on the homepage of the calendar. You just hit the link and you're on.
Great. Oh, very good. So you can have opportunity to connect as well. Well, thank you so much for your service, Leroy. I truly mean that. And thank you so much for calling and being a friend of the show. I'm glad that we're here for you as well. And thank you so much, Dr. Hanscom. You've been a great fountain of information, lots of great connections that were made here about inflammation and pain and anxiety and anger and how to really reduce all of that so that we're not as susceptible to the viruses around these superbugs. So it's very helpful. Thank you so much for your time tonight. I appreciate your being awake at this hour. Yay!
Yeah,
thank you.
Thank you very much. I enjoyed talking to you on the TV show, and this has been really wonderful. So this is great.
Yes, if you'd like to catch that, I've done a whole hour interview with Dr. David Hanscom on Free Speech TV, and you can go to theawareshow.com/Free Speech TV, or you can also check out backincontrol.com for Dr. David Hanscom's protocol. Thank you so much, and I also want to say thank you to George Norrie and Tommy Danheiser and Michael Casio, who are with me in studio, and Sheena Salvati here with me in studio. And did I say Tommy D? I did. And Lisa Lyons, Stephanie Smith, Chris Boros, you guys are all rock stars. Thank you so much. You help make all of this happen. And Lex, web designing, and everybody. I am Lisa Garr, and until next time, I invite you to always stay aware.